Wonderful, welcome. So good morning to colleagues here in the U.S. and good afternoon and even good evening to folks joining us from Africa. We are so delighted you are with us today. I'm Janet Gilla, Director of Professional Development at Brown School, also an alum of our MSW program. It's so happy to welcome you to Open Classroom. This session is being recorded, but your video and audio is muted as members of our audience. We'd like to encourage you to please use the chat feature to check in with us, share your comments, your questions, any resources throughout the duration of the program. The Dean and also Betsy Abente will be moderating those questions for you. Before we get started, I want to share a couple programming notes, things that we have coming up for you here on Open Classroom. We are doing a double header today. We're back on at 4 p.m. Central Time for a workshop on systemic racism and mental health. This is co-sponsored with the American Academy on Social Work and Social Welfare, colleagues at USC and UCLA. Registration for this afternoon's event is closed, but will be live on YouTube. So if you didn't have an opportunity to register and you want to join us, please do. And then we are back in our normal time slot, Tuesday, 12:30 Central Time, when Dr. Megan Keys and Dr. Julie Masnack are delivering a program on increasing client engagement for folks with PTSD during the pandemic. Registration is still open for that, and I'll be throwing links into the chat about how you can sign up to join. So today's program, this marks our 43rd Open Classroom, which is pretty amazing to me. It's been nearly 5 months since the public health situation in the U.S. made large in-person gatherings ill-advised. But the Brown School has always been about gathering community for learning. And this virtual series is one of the ways that we've responded to the new realities. Amid the loss and uncertainty that we are all experiencing, this has offered an opportunity for connection. And I really want to thank all of you for being a part of that, whether you're panelists or in the audience. It's a wonderful thing that we're able to share together, and thank you for that. I'm particularly excited about today's program and grateful for the collaborators with Smart Africa and iChat, because this is the farthest that we've leaned into the possibilities of our virtual connections. We've had international presenters, we've had international participants, but this is the first time that we've had people in 4 countries and 3 time zones all joining live. I find this pretty amazing and I can't wait. So to introduce our speakers today and moderate, it's my great pleasure to introduce the leader of our school, who is the best leader you could possibly hope for in times like the ones we're facing right now. My great honor to introduce the Nydorf Family and Centene Corporation Dean of our school, Mary McKay. Please welcome.
Thank you, Janet, and thank you everyone for being here. And I am thrilled to introduce you to colleagues that I have worked with for years and collaborated on some of the most important work related to children and their families. And so I'm going to give us a little bit of an introduction around some of the work that we're doing in collaboration with our panelists. And then I'm going to ask each of our panelists to introduce themselves briefly. And I'll kick us off with some questions about how what is affecting us around the globe, COVID-19, how that's affected some of the country context and some of the important work that they're trying to move forward with resilience and innovation. So, so my colleague, Betsy, which is, I guess you're to my left, Betsy, is going to share some slides with us. And I'm so glad that on this first slide, we introduce a center that is funded by the National Institute of Mental Health. And my colleague for Fred, I'm pretty sure 15 years now, Dr. Fred, along with my other colleague, Kimberly Hoagwood, and I, and then our panelists have been so involved in this effort that we call Smart Africa, that focuses in on young people, strengthening them, their mental health, their well-being, and families. If you go to the next slide, Betsy. So there you are, Dr. Fred, and then our panelists are next. And this, if you think about, you know, how to actually accomplish something meaningful for children and their families, it does take a village. It takes true collaboration, and it definitely takes talent, leaders that lead the work in country context. So I think about myself, Janet, whether I think about myself as the dean, or I think of myself as a co-director of Smart Africa, my job is to really support the people in country closest to the children, closest to the family, to develop the capacity to actually lead the work in their country context. And so Dr. Fred always talks about kind of bi-directional influence. In Smart Africa's case, really, these are the leaders of the work, and I have the privilege of helping to bring support, whether those be financial supports or other resources to bring to bear so that kids and families in other country contexts can be well, and their families can get the support and their schools can get the support that they need. Next slide, please. So as Janet mentioned, Smart Africa is a collaboration with US investigators and across 4 countries in Sub-Saharan Africa. And I've had the real privilege of working with our colleagues in Uganda, in Ghana, in Kenya, in South Africa, and really all for a single purpose, which is to really support leadership to help children be emotionally well, to support their families, to support their schools, so that children can live vibrant, contributing lives. And so I'm incredibly grateful that our leaders have come together across the globe to talk about Smart Africa. Next slide, Betsy. So, you know, Smart Africa is a multi-component center. And so one of the things that I'm so grateful to this team for is they do 2 things. They take the very best science around how to help children, but really then figure out how does that apply or not apply to kids and their families around the globe. And so this particular intervention that our colleagues are working with is a multiple family group intervention where in the US we brought together children and their families who were having emotional or behavioral challenges. We brought them together to address those challenges. This work was right for the country context that I worked in New York, in Chicago, because our parents, our young people, our service providers weighed in and made the science really relevant to our context. That's been the job of our collaborators around the globe as well. Please go ahead, Betsy. So each one of our colleagues is testing in one way or the other, whether it be Dr. Fred and Joshua and team in Uganda, in a very large scale test of what we call multiple family group. We're training, you know, we're working in primary health clinics, we're working in schools, we're training community health workers and parent peers to deliver these interventions, or in smaller tests in Ghana and Kenya, again, using science, but also collaborating with young people, family members, school officials, healthcare workers, to really create interventions and programs that reflect the country context. Next slide. And so, Dr. Fred, anything you want to say about our scale-up study? Because this is a study that has involved thousands of young people and their families. So anything that you wanted to say about the work in Uganda?
Thank you so much, Dean Mary. I think Joshua will say a lot about, you know, what we have been doing in Uganda, but what people should know is that we are working in 30 schools in Uganda, and we recruited close to 3,000 kids and their caregivers. So these are dyads. And what we are really trying to do in Uganda is to use a task shifting model, knowing that the country has 1 psychiatry per 100,000 people that may need those services. How about if we take advantage of the community healthcare workers? How about if we take advantage of the peer parents to be able to screen these behavior difficulties so that not everyone ends up in a hospital or in Butarika or such places. And then our colleagues in Kenya are supposed to learn from Uganda, and our colleagues in Ghana are supposed also to learn from Uganda, and then really collectively, we are trying to promote the South collaboration, where we learn technically, we learn from each other, and so others will come through as we engage in the discussion. But probably that's all I can say.
Beautiful, thanks. And it's so good. I'm glad to hear your voice, because this has been such an effort, and you've been an amazing leader with a team, a very, very large team, to really scale and test this particular intervention. Next slide, Betsy. So you'll hear very soon from my colleague Emmanuel, who has been one of the prime leaders in Ghana, and some of the particular kind of issues that they have faced and the opportunities that they've taken advantage of. And so you'll hear from Emmanuel, and then next slide. You'll also hear from my colleagues in Kenya. So on my little squares, I can see Dr. Muthoni. Hopefully Anne will be joining us soon if she's not here already. And you'll hear a little bit about also what they've learned in their country context around working with children in schools, as well as how COVID has affected their operations. So one of the things that I'm incredibly grateful to this team and so many of our colleagues is that the work not only happens on the ground, but there's a deep commitment to rapidly disseminating what we're finding so that others can make use of our lessons learned, our data, and also there has been a dearth of information around children's mental health, around ways that you can support children's emotional well-being in Sub-Saharan Africa. And so we want to fill that gap. And so I'm incredibly grateful to our colleagues for publishing, and these are available, and certainly will make some information available about those findings as well. Next slide, Betsy. So, in the center, there's certainly a lot of research activities, and there's also a lot of building capacity. Not only, support for our lead investigators, but pipelines for the next generation of investigators as well. We've done a lot of in-country training. The South-to-South collaboration, I think, is incredibly important. And what I know about Muthoni, Fred, Emmanuel, Abdullah, so many others in our group, is you are also growing the next generation of students to get their PhDs. And I know Joshua will say this as well, but he will be joining us in the States for a PhD in just a couple of weeks. And so, and all of us have stories of investigators that we're trying to bring on to this particular work. So mentoring the next generation of scholars, we had both a rigorous set of training programs planned. We had hoped to actually be on the continent this summer. COVID stopped us from being present in an annual conference, but it did not stop our training. And so there has been many opportunities for virtual training over the summer. And Dr. Fred, hopefully we can talk a little bit about some of those fellowship programs if we have time as well, because they're incredibly important to providing support and really opening up a pipeline of new scholars to this work. So Betsy, I think this is my last slide next. But important. And so one of the things that that we are deeply committed to, that have been actually required as part of our funding with National Institute of Mental Health, is that we certainly take research in our country context incredibly seriously. We support the capacity of Sub-Saharan African investigators to take the lead in those studies, but we also are trying to use science to influence policy around children's mental health. If you go to the iChad website at Washington University in St. Louis, the Brown School, you will see examples of the types of policy briefs, the types of conferences that we have had to really help leaders from the highest official in the government use science to improve the circumstances of children in the country. And if Fred has time, or Joshua or others, you might want to talk about why this is so important to invest in children on the continent overall, but in Sub-Saharan Africa, because there's a very high proportion of children who are young and who need investment, and they will be the next leaders of the country context. So with that, Betsy, I think I'll stop sharing the screen. And go to other voices that I'm much more interested in hearing than my own. And so I'm going to ask our panelists if that would be possible. Maybe Joshua, you first. To Joshua, then Muthoni, Emmanuel, and Anne. That's kind of the order you are in my screen. If you'll make a brief introduction of yourself, please, and your role on Smart Africa. So Joshua, please.
Yeah, thank you, Dean Mary. Thanks for the nice presentation. I'm Joshua Kiyingi. I coordinate Smart Africa in Uganda, and I also coordinate another study called Chaterikra. These are all RO1 studies funded by NIH. I'm soon joining Washington University in St. Louis for a doctoral program in public health sciences. I'll be starting on the 24th of August. Thank you so much.
We look forward to welcoming you in St. Louis, for sure.
Thank you.
Dr. Muthoni, maybe you could go next.
I don't know, good morning, good evening, depending on where you are. I'm Muthoni Mathai. I'm a psychiatrist. I'm associate professor with the Department of Psychiatry at the University of Nairobi. And I've been with Smart Africa as a co-investigator in Kenya from the beginning, and this was started at the end of another NIH project that we had, which was mental health capacity building, and so it really fitted very, very well into it. It was almost like a flow into it, and so we've had a lot of capacity building in our region, in the city. We've done a lot of collaboration with teachers, with policymakers, and this has changed actually in the places where we are working. It has changed the way teachers look at children, the way parents look at teachers, and we've even had a request from other areas whether we could spread this to other areas. So, but I'll leave it to my colleague, Dr. Ann Boyo, to give us more details on that. Thank you very much.
Wonderful, wonderful. So Emmanuel, it's good to see you. A brief introduction.
Sure, so
please.
Good afternoon to colleagues in Africa and obviously morning in the US. So good morning to everybody and good to be with you. My name is Emmanuel Asampong. I'm a clinical psychologist by training, and I teach in the School of Public Health, specifically in the Department of Social and Behavioral Sciences. So I have also been part of the Smart Africa team right from the beginning. And I must say that it's been an exciting adventure. Adventure because there are so many interesting things that are coming up. And I guess that for the period, 4 years running, it's brought on a lot of experiences that have shaped the way I teach, especially when it has to do with mental health issues in Ghana. So I'm happy to be with all of you.
Beautiful. Emmanuel, thank you. Welcome. And Anne, I believe you're with us. If you could do a brief introduction of yourself, please.
Yes, good morning, good afternoon. I hope you can hear me. Thank you to see you. My name is Anne Boyo, and initially my first training is a teaching high school teacher, and I've taught and I've enjoyed teaching. And so my interest has always been in schools. And so this project really came at a time when having worked in the project of Muthoni, I found that is very interesting. And going to the schools, telling the teachers, my fellow teachers, and interacting with parents as at another level. I taught in high school, though worked in primary school. It was really exciting, and having been a fellow in the Partnership in Health Research Training, PHAT, or where I also worked within schools, so I got even a better view of primary school teachers and the parents, and the need, how they look forward to learning more, to getting more knowledge, more information on how to bring up their children. So this study really fitted very well. So I'm a clinical psychologist. Thank you.
Beautiful.
Department of Psychiatry. Thank you.
It's wonderful to see you. It's wonderful to see you.
To see you.
And so I'm going to go back to Joshua in a minute to talk a little bit about the scale-up study in Uganda. Dr. Fred, do you want to say any other words about ICHAD? And because I think that this represents a set of colleagues that are very special. The other thing I know about Dr. Fred and the efforts that you have put in country in Uganda and then across Sub-Saharan Africa is that these are long-term colleagues, not brief one project colleagues, but we made deep investments in the relationships to continue the work. And so I appreciate you figuring out when to say a word about ICHAD if you'd like to do that. So Joshua, you have a set of slides that you want to share with us. Kick us off.
Yeah, Betsy, you have the slide. Yeah, thank you, Betsy. Yeah, we're going to talk about the challenges and opportunities in South Africa and Sub-Saharan Africa during COVID-19. And we are going to be presenting experiences from Smart Africa Uganda. Yeah, next slide. Yeah, Uganda, we are trying to get used to the new normal, working with the COVID, because I don't think it will be going away very soon. And we are trying to adjust to that. In Uganda, we recorded our first COVID-19 case in March 2020. That was on the 22nd. And but our neighbors, that is Kenya, Tanzania, Democratic Republic of Congo, they have reported their cases earlier. So our president moved in swiftly and took action. And on 18th March, the president ordered the closure of all the education institutions. This included kindergartens, primary schools, secondary schools, and all the universities. But remember, we are working with schools, and these are primary schools. So all these were closed. So our work came to a standstill. And on 30th, we went to a total lockdown, where the borders were closed, and even our own international airport we have was also closed. It was only the essential workers who were allowed to move. Those are medical workers and food vendors, security, and the bankers. And currently we have recorded 1,213 cases. These are confirmed cases by the Ministry of Health, and a total of 1,773 patients have recovered from the COVID-19. We have 5 reported deaths and 96 active cases. This information is from the Ministry of Health website. You can go and check that. But the lockdown is being eased gradually. We have the public transport now active. Shopping malls are open. Government offices are also open. And other offices here at ICHAD, we are working. Our offices are open. And even the salons are open. That's why I have a clean shave better than Dr. Fred. Yeah, but the education institutions are still closed. The schools where we work in are also closed. The borders are still closed, and the airport is still closed. Yeah, but under Smart Africa in Uganda, as Dean Mary mentioned, we are working in 30 schools. And by the time we went into when the schools were closed on the 18th March, we were delivering the multiple family group sessions across 8 primary schools. And we are meeting a total of 616 families per week. And these are, we group them into up to 20 families, and these sessions are delivered within a school, within the school premises. So right now the schools are closed, so and the kids are back home, so we can't do anything about the sessions. By the time we closed, we had delivered up to session 13, and we were remaining with 3 sessions to go. So that came to a standstill. We had also planned data collection for the 6 months follow-up assessment, which is our last data point under Smart Africa in 4 schools. And we had also planned a 16 weeks follow-up assessment in the 8 schools where we were delivering the MFG sessions. So after all the 16 sessions have been completed, we do a data collection at another point of data collection, which is the 16 weeks follow-up assessment. So all this came to a standstill and we couldn't do anything. Lucky enough, our IRB, that is Uganda Virus Research Institute, and Uganda National Council of Science and Technology, guided us to move to telephone interviews for the active protocols, and our protocol is active. And yeah, this was new to us. It was new to ICHAD. We had never done telephone interviews. We are used to face-to-face interviews when we are collecting data. And Dr. Fred came in quickly. He organized training sessions on how to conduct telephone interviews. We have had a series of trainings conducted by him. And I think, if I remember, we have had over 10 sessions. We have been doing this on a weekly, and the team is really good. They are really good to go. After the trainings, we conducted a pre-test to test how this process will work, the telephone interviews. We invited a couple of participants from our Smart Africa study, and we tested it out. It was successful, and obviously it had a number of challenges, but these ones can be overcome. And as I mentioned in my introduction, I also coordinate another study called Chatelekera. Here our participants are women engaged in sex work. So we first tested out the telephone interviews with the participants under Chatelekera. We did our first telephone interview on 20th July. It was successful, and I'm sure the SMART team is learning a lot from the Chatelekera team. We've had a number of challenges like telephone connection when you're in a field. You know, we work in remote areas where mobile network is really a challenge, and sometimes you don't have control over that. So what we have done under Chatelekera, we have set up a call center at ICHAD, and we have smartphones and headphones, which we move with them. We move with these to the field. We call our participants and gather in an open place, let me say gardens, hotel gardens, so that they can space out properly. We give them our mobile handsets, and the team at the field, in office at the call center, they call in these participants, and the interview goes on. But we make sure we follow the SOPs stipulated by the Ministry of Health. And so when we meet the participants, we make sure we sanitize them. If they don't have masks, we give them masks. We take their temperatures. We have gun temperatures. We check their temperatures. We have hotlines for the COVID-19 task forces in the districts we are working in. And in case someone has temperatures beyond 37.7 degrees Celsius, we call in the task force, but we have not had any case like that. Yeah, so the process is moving on smoothly, and the SMART team has learned a lot from the Chatelekera team, and we have set our first interview with a SMART participant on 10th August 2020. We shall be testing this out. Yeah, and we have also configured our offices to make sure we have room for social distancing, and we are trying to limit the visitors coming into our offices. And we have also developed a risk management plan. This was sent to our IRB, that is Uganda Virus Research Institute, and Uganda Council for Science and Technology, and it was approved. So we are following this risk management plan when we go and visit our participants. For Smart Africa, unlike Chatelekera, where we have been calling the participants at a central place, for Smart Africa, we are going to be visiting them in their homes. So we are trying to set up meetings with the guardians and the kids in their homes. So we are going to be visiting them in their homes. We are going to be moving with our telephone handsets, the mobile handsets, and the headsets. We move to the home of the participant. We alert our call center supervisor that now we can start the call. So the RA, or the research assistant at the call center, calls the participant when the supervisor or the field supervisor is at the home of the participant, and the interview will go on. We are mindful of the attention span of the participants when they are talking on the phone, when the interview is going on the phone. So we make sure we give them breaks during the interview, because some of our interviews can take up to an hour. So we make sure we at least give like 2 breaks or 1 to refresh, so that someone doesn't get fatigued over the phone talking to the RA on the phone. So that's how far we have gone in Uganda. And
Beautiful.
we shall be reporting on this. So now the process is moving on when we start the actual interviews, the actual telephone interviews on the 10th of August, 2020.
What I so appreciate, Joshua, about you and your colleagues is the care, in a pandemic, in an unprecedented situation, your ability to take the best public health guidance, follow that, but also understand that there's lots of obstacles. And so you combine kind of the best science with also a resilience and a commitment to staying in touch with kids and their families, that connection, and that their voice in the research is not lost as a result of the pandemic, I think is incredibly important, and should set you up very well for that PhD you want to pursue in public health in just a few weeks. So, so thank you for sharing that. So I wonder, excuse me, Emmanuel, if you want to talk a little bit about the specific context in Ghana and any things that you've learned, and then Muthoni and Anne, I'll have you do the very same in terms of how you responded to COVID and how you really tried to kind of adjust the plan based on the pandemic.
Okay, thank you very much, Dean Mary. Just like it's been happening all over, for us in Ghana, I think that this whole thing took us by surprise. The reason being that we were actually counting on how we fared during the Ebola outbreak. Fortunately for us, I mean, we didn't have any case of Ebola. So we thought that perhaps, I mean, we could sail through this one as well. Unfortunately, on the 12th of March, Ghana reported the very first 2 cases. I mean, it was confirmed. And that actually started some wave of fear among the populace. In fact, in less than 2 weeks, the number had spiked from 2 to 137. And the most dangerous aspect of it was that there were local transmissions as well. Because originally the thinking was that it was mainly about people who had traveled abroad and were coming into the country. And then all of a sudden we had people who had not been anywhere, you know, people who are residents in country and were, you know, reporting cases of COVID. And so it brought a lot of fear. Initially, there was a government response, and this was I mean, the closure of universities, schools, churches, mosques. In fact, there was a total ban on all public gatherings. I mean, whilst all that was going on, the numbers were still, spiking. And so it became necessary that a lockdown was imposed on two epicenters. And these were the capital, Greater Accra, and then Greater Kumasi. I mean, and interestingly, because again, there are some adjoining towns, all these towns were also part of the lockdown. There was also closure of all the country's borders by land, by sea, by air. And in fact, for those who managed to come in, there was a mandatory 14-day quarantine, especially if you were coming from a country that had recorded 200 cases and above. Then you necessarily would have to be quarantined for 14 days. And for all this period, it was only essential service providers who were allowed to move. But even that, you needed to have a security pass, because then military men and women, the police were all put out there in the public to ensure that people were adhering strictly to, the measures that had been put in place. For Smart Africa Ghana, our study was going on smoothly. In fact, we had moved on to our second treatment group and had actually done the 6th week of the MFG sessions. In fact, we were to do the 7th one, preceding Saturday. That was exactly when the closure, happened. And so we couldn't do that. For that, we were also to do a follow-up for the very first treatment group. So, of course, that one also, we couldn't do that. We had some issues with the IRB. Normally, what we do is that we try to go for the continuous approval way before the expiration date. And so, just when we were about to submit, they also closed down. And so we couldn't do that. Fortunately, we had some weeks, because then our approval was expiring in May. And so we had some time. Normally, they would require that we brought hard copies. But all of a sudden, they sent mails to us not to submit any hard copy, but to send them the soft copy. And in fact, that was quite interesting because this is an office that usually, when you even go with a soft copy, they will not take it. They would expect that you give them the hard copy. And all of a sudden, they are turning, back to tell us to send the soft copy. So that was quite interesting. But essentially, they expected us to include, as part of our report, measures that we were going to take in addition to measures that had been announced by government, if we were going to, as it were, continue with our study, but of course not face to face. So we did that and then sent it, and fortunately we got our approval. But as far as the study was concerned, what we initially thought was that, and of course following from the Uganda experience, we thought that we were also going to conduct our activities via telephone. And just like, we've always had, the benefit of having meetings with PIs in WashU, Dean Mary, Dr. Fred, Dr. Osger, we had one of such meetings. And we eventually, what we arrived at was the need for us to engage the families that were part of the study, to find out from them what their thoughts were. If we were going to continue on, if we were not going to continue on, what really were their thoughts. And again, that was a learning experience, because very often what we have done is to try take decisions and impose it on people who are going to consume, the end users. But this time, the thinking that we're going to engage them meant that they were going to bring their realities to bear. So that was done. for all 60 participants. And at the end of it all, 56 of them actually emphasized the need for us to continue with the remaining 10 sessions. As to how we're going to do that, but their emphasis was that we continued. Of course, we also reached out to the facilitators and then the teachers who were in the participating school, and they also said yes. In fact, it was more like something that if we didn't continue, they weren't going to be happy with it. So what we then had to do was to try and see what measures were we going to put in place to ensure that we could go ahead, with the rest of our activities, making sure that we're not going to encounter any challenges. And so that's what we've been doing so far. And I think that in respect of acquiring the requisite PPEs and all those things, those are some of the decisions that we are taking now so that we can commence with the rest of activities left.
Emmanuel, we so appreciate your commitment to the participants, but also modeling that you went right to the participants to ask their wishes, their preferences, and then are designing, an opportunity for them also with the best public health kind of safety in mind. I think that that's really the combination, the way forward in what we're experiencing, which is this pandemic that continues. Muthoni, and I know that I want to make sure that we have your voice from Kenya as well. If you want to give us some sense of how the schools have been impacted and your kind of process, it would be wonderful to hear from both of you as well.
Okay, I can start and give about the school.
I think I'll let Dr. Boyo so that she has enough time to talk about the study. Yeah.
I think Muthoni's saying go ahead. Yeah.
Okay. She normally gives a very good summary of the COVID situation in Kenya. So, but I can talk about the study. But after a case, just like in Ghana and Uganda, after a case was the first announcement, which was on a Friday. It was on a Friday, and the schools were told to close. So the day schools did not report to school on 16th, 13th, the next week, Friday, 13th March, then the Monday. The schools were closed. They were not supposed to open, and the boarding schools were told to close by 13th, by 7th, the Wednesday of that same week, and all institutions of learning by Friday. So that same week, all institutions of learning were closed, and the country somehow, we were closed, no activities. All those are the activities that we did that were closed. Now we had, for Kenya, we had done our MFG at the same time, both the community health volunteers, school-led, and the peer parents led. So we had felt we wanted to start together because we had thought sometimes anything can happen which would affect the results when we do not work together. So we started the schools at the same time, and we had completed the MFGs. We had completed and had done the eighth week after the 8th week assessment. So we were to do the 16th week after the 16th week assessment, and then with the close, now we were not able to do that. We took our work after we realized the other researchers were asking for, from ethics, whether they can do mobile interviews and all that. We also wrote to ethics and asked whether we can have an amendment, and we got clearance that we can go ahead and do the phone interviews there. But we got for both the parents and the children, but then we are like, so we thought, let's get both of them. But then the question we are trying to find out, the child will use the parent's phone, will the parent have left or gone to let the child have the privacy that he or she will require for the assessment? So that's the point at which we are in. We have to debate. So anytime we can go for that data correction. So the timing now of the data correction was affected. We are not able to do that, but we have the ethical clearance.
Beautiful.
We included in the, when we were asking for amendment, just a question, just to find out how the parents fared, just to compare the responses from the from the schools which had the education, mental health education, and those ones which had MFGs. So once we start, we are going to ask how they are faring within the COVID, whether any of the information helped them to take care of the children, and how they are feeling. Now, we had gone to the schools once when they were doing their last sessions, and we were fortunate, we were with Yen, we went to the schools, and the questions was like, what next? We have been so used, this was our meeting point, it was an interesting program. Is there anything, a way forward? So we told them, first of all, you ambassadors, you have had a discussion, you have learned within your small group meetings, which we popularly call chamas, meetings of people who have interest things of groups for something, go start teaching. But what was important was how they were expressing. They had never thought that they can sit with their children, have discussions, make rules. It was one of those interesting things. Oh, you mean we can make rules even with our children, and so on. So they felt it was very helpful. So we'll start calling the parents now that we have the clearance. First of all, the metropolis had been closed, so we could not even go. It's the other day when it was where the schools are, had been closed, we couldn't go. But now it was opened. We have the review, allowed to do telephone interview. So I think what is even good is that we are having, there's another study Muthoni is leading where we are using telephone. So we are going to use the skills from that study for telephone interviews and using the instruments to, and a number of the people who are in that study of Muthoni are part of our researchers. So I'm assuming they'll have gained lots of experience on mobile interview. In fact, is like a blessing. So you'll be able to use those skills to interview the parents when we get to them. I think that's the most that I have, unless I don't even forgotten anything.
So Muthoni, anything that you want to add? Because I think Ann did a beautiful job, please.
No, I have nothing more to add. I think she has really covered the main issues. And as far as COVID is concerned, we're just faring like Ghana, less like Uganda, but more like Ghana with very high numbers at the moment.
Okay.
That's all.
And I think what Muthoni, both you and Ann have modeled, but our other colleagues, is to really be resilient, but also think about how you integrate the best public health science, the best protective measures for your staff, for your participants. And then the other thing that, Ann, I heard you say really well is, and this is actually a part of so many of our thinking about these interventions, that if you train peer parents, if you prepare community health workers, they remain a resource in the community, that they're not dependent on kind of outside only funded projects, but that in fact, parents and kids can carry forward using the skills that they used. Health workers and peer parents can support them in other ways. So these interventions are not supposed to be so complicated that you can't leave them in a community and they make a difference. And I think that that really is some of the hallmarks of what you're trying to do in schools and communities. So Betsy, I know that we don't have a lot of time, but I see a couple of questions come through the chat. Do you want to give us a question or two that our panelists might be able to answer?
There's just an easy one about the geographic location of our studies in Uganda. There's a participant that actually works in Uganda, so she was curious about that. And then the follow-up question to that is she's also curious about challenges and lessons learned from the South to South partnerships that were mentioned, specifically, you know, how Uganda and Kenya are working together, and also the East-West Africa dynamic, if any of the panelists want to address those.
So somebody really does know the issues and the things that you have to bridge. So first, our Ugandan colleagues, could you just talk about the region that we're in? And then what are the challenges of really supporting South to South collaboration? But first, Uganda. Joshua, do you want to just tell us what region?
Yeah, in Uganda, we are working in southwestern Uganda, and we are covering 3 districts. That is Kalungu district, Masaka district, and Chiotera.
Beautiful, beautiful. So several hours by car outside the capital city.
Like 2 hours on the road from Kampala.
Very good. And the road is quite improved from when I first traveled to Uganda. So colleagues, South to South collaboration, how you've been able to work together, share information. What are some tips and some things that you had to kind of navigate as you went forward? Muthoni, you want to describe? Oh, go ahead, Anne. Go ahead.
I would just put one point, and Muthoni would expound, is that we found ourselves, for example, really relying on Uganda for guidance. And every time we would write, and every time we wanted something, we found ourselves really a lot asking Uganda, how did it go? Even in the last conference, we had to sit and just find out, how did it go? So that collaboration in terms of those who were ahead of us, how they went about it, I found that very helpful, that there was a bigger brother to watch over us and guide us. Muthoni?
I just want to say that for us, I think Kenya and Uganda have so many similarities, even the historical backgrounds, that there was not much we needed to navigate in. I mean, we sometimes even understand each other's languages, not so clearly, but, and even the school systems, slightly different, but very many similarities. So I found it like, it made it much easier for us to collaborate, because we are working on the same. And the fact that at the moment we have all these resources of Wi-Fi, it has actually made things easier in terms of communications, so that those regular Skype meetings have really helped to stay on the same. So I think that kind of communication is very, very important. Thank you.
Okay, so I think we in Ghana can also come in here. Right from the beginning, we used to have, quite apart from the in-country meetings, we're also having the different hubs coming together on a monthly basis to, as it were, learn from each other. But I mean, in all of these, I think that we have also reached out largely to Uganda. And we have always done that through certain conduits. I mean, Professor Fred and Osger, who have given us that support to reach out very well to Uganda. We have learned quite a lot, and I must put on record that based on a paper that our Ugandan colleagues published, we in Ghana have also submitted a paper to the Psychiatric Services Journal. And so it's more like at the back of Uganda, and then once they hit, then we also learn how to hit.
I think that what has, you know, if I can also just be the observer, is from very early on, we did two things that I think both of you have mentioned, which is that we talk regularly. And you're right, Muthoni, as the Wi-Fi got better and better, that communication got easier. The second thing is that there is sometimes no substitution for face-to-face. So at least once a year, coming together at the annual conferences, I think was really important, because relationships do matter, and learning from each other both in person at the conferences as well as that very investment of regular communication. And I think that has really helped some of the collaboration. And I also think that Emmanuel, the paper that you wrote, the paper that the Kenyan, our Kenyan colleagues have submitted, incredibly important that you are also the knowledge producers in country. And I do think, Fred, you've set up a very generous system, right? Uganda had a number of strengths, and you kind of really generously gave away all the tips, all the learning. I know, Joshua, that you've just shared all the elements of your protocol, and that generous sharing of things that took a lot of work really helped the work go faster. And I do think that spirit is really important. Betsy, I know that we're at time. Dr. Fred, do you want to make any final comment before I sum us up?
No, I just want to thank you so much, Dean Mary. I want to thank our panelists, and I want to thank our attendees. Hopefully this is not the last that we will be doing this. We are global, as you can tell, and we encourage collaborations, and please stay tuned for other events like this. So thank you so much, Dean Mary. I pass this back to you.
Thank you. So thank you to Open Classrooms for giving us this opportunity. Betsy, you're a star organizing us all. And to my colleagues, please stay healthy, please stay safe, and please demonstrate the resilience so that we can support kids and families in a whole bunch of complex circumstances. Everyone, please have a good day or evening. Thank you so much.
Thank you very much.
Thank you.